Emma here. I just thought I'm going to put together a series of vlogs looking at how we coped when Erin was in spica. Erin was in spica, which is a body cast from her belly to her ankles with a bar at the knees for 24 weeks while her hip was being fixed. Erin was born with developmental dysplasia of the hip, DDH for short. It can be tricky, so I want to share the products that we use and the ways that we got around Erin being in spica for so long. The first question people always ask about is nappy changing. Erin was still in nappies and needed obviously to be changed 4 or 5 times a day, like your average 2-2.5-year-old. For us, nappy changing got easier. It does take a while, but by the end of it, you know, you'll be doing this in your sleep. You'll be able to quickly change a nappy. Really difficult to do it outdoors anywhere. There's just not enough space. You really need to be doing it on the floor because you have to flip the child right over. You can't just obviously lift up their legs. So you do need to try to not be outside when you need to change a nappy. Not always easy, obviously, especially if they have a poo and you need to change them, but then you're just going to have to find somewhere where you've got space. I used to do it in the car, my boot, big boot, and so I could lie her in there. Not the best, but the best way of managing at that time. I was able to use normal size nappies. I would put the nappy in the front and put my hand down the spica and pull it up. I would then flip Erin over, push again the nappy up through the bottom hole and arms down and be able to pull up, flip her back over, and then actually I could do the tabs up. So we didn't have any leaks, but it depends on the hole and the size of the hole. If your hole's really small, I would consider asking your surgeon or the plaster technician team if they can just make it a bit bigger for you, because it will make life so much easier. I kept to the same nappy size and nappy brand and didn't have any problems, but you know, half the time I was touching wood and just thanking my lucky stars that we got through a day without having any nappy explosions. It can be done, and you'll get quicker and quicker, and you'll be able to do it, you know, really quickly after just a few goes. The child is probably quite swollen at first, so you know, you do have to be really careful those first few days and be really gentle, but as the swelling goes down and you get more confident handling the spica, and as the child, you know, gets more used to it as well, it does become easier. The other area people always are asking about is bathing. Obviously 24 weeks in a cast, your child still needs to be regularly washed and hair washes. I think the best thing to remember though is, you know, child's hair is not like adult's hair. They don't get greasy, so they do not need to be washed, have a hair wash every day. You know, they don't even need it really more than once a week. What I would do is wash their hair once a week, and in the week use some dry shampoo. I used lots of different brands, it didn't really matter, and that just keeps it fresh in between washes. As for bathing itself, you can't get the cast wet. You need to be really, really careful. If the cast gets wet a little bit, you can blow dry it out, but you know, that's not very ideal for the child to have a hairdryer on them or to be using the cast cooler too frequently. So what I would do is bath Erin on our kitchen sink and drainer. I would make sure I've got all the products that I wanted first, so you know, a little bit of baby bath or whatever you were using, flannel, some talcum powder to, you know, help dry her off at the end. Have my big towel. I would take a couple of towels down to the kitchen sink and get it all ready. I would have the kitchen units all clutter free, nothing there, and run the tap, fill up the bowl before I'd even picked up Erin. Then you can get your child, strip them off, and again I would strip Erin off totally. You can leave the nappy on. I like to have a few minutes with getting some fresh air around her bottom at the same time, but you know, whatever works for you. Lie the child on the drainer, okay, and she would lie on her stomach, towel on the drainer so that she wouldn't get too wet, and she would spend a couple of minutes just playing with water, because you know, all children love water play, and it seems a shame that if they're in spica that they can't have that. And I also didn't want Erin to get a fear of water because she wasn't being bathed and touching and playing with water for so long. So I would let her just play with some water while I washed her back with a soft flannel and a bit of, body oil or body wash, whatever you use, your normal brands. Then when it was time to wash her hair, I would flip her over so she was lying on her back. I would move her up a little bit so that her head was over the bowl, and then with my jug that I had ready, I could wash her hair. I could pour the water over, shampoo it up and rinse it off. And it really was that straightforward. Again, because she's then led on a towel, you can quickly wrap the towel around her and lift her off and take her into another room where you've got, your changing mat ready and the clothes that you need. So I would then carry her in, through into the lounge, pop her on my plastic change mat in the lounge and get her dressed. I didn't bother going up and downstairs with her in Spica. I didn't really want to be carrying her around that much. She's too heavy. It was, back breaking. So I would make sure that everything was downstairs ready for us, and then I would get her dressed down there. When we had water play, we could play with some bubbles. She could splash about with her arms a little bit. She actually had some toys in there, and it's great. You have to be watched, obviously, but if they're a bit older, like Erin was at 2.5, they will tell you as well when they start aching, or if they're not comfortable. The first few times I bathed her like that, I did it when my husband was around. We sort of did it together so that I had that extra pair of hands. I was paranoid about dropping her, or being slippy and not having a good grip on her. But again, as you get used to it, it really isn't as hard as you think it's going to be. I think the biggest thing then is just to be super organised, make sure you've got everything you need so that you don't have to turn your back on them, because obviously you can't walk away leaving her on the drainer. And then just have a little bit of fun for a few minutes. I used to do it when there was nobody else in the house, when the other two were at school, so that I wasn't going to get disturbed, and just give her a nice little wash her hair, and then we could sit in the lounge and get dressed and have a nice cuddle. Okay, thanks for listening to this. If there are any specific things people want to know, tricks or how-tos on Spica care, just leave me a message in the comments and I will have a go at answering them. I don't profess to know everything, but after 24 weeks of Spica we did experience most things. I'm also going to vlog about eating at the tables and the types of activities that we used to do when in Spica, so do come back and check out my other how-to tutorials.